How's it going, guys? We have a past level question for neuro for step 1 internal medicine 2CK. 69-year-old man had a recent stroke, cerebral infarction, affecting the lateral aspect of his left cerebral hemisphere and to the central solstice. Okay, and then we have ischemic penumbra that was demonstrated. Penumbra is just a fancy way of saying tissue that's on the verge of necrosis, but it's not there yet. For example, if we have ischemic stroke and we give TPA, within 4.5 hours, we can help mitigate the probability of necrosis of that penumbric tissue. So good vocab word to know for stroke. Question wants to know which following vessels is affected, as well as our motor or sensory dysfunction, okay? Part of the body that's affected. So past level, as I said. So first, anterior cerebral artery or middle cerebral artery. You need to know that if the lateral aspect of one of the cerebral hemispheres is involved, that's going to be the middle cerebral artery, okay? So if the medial aspect of the cerebral hemisphere is involved, in contrast, that would be anterior cerebral artery. Now, I will link my neuroanatomy PDF below. I've got cross sections, diagrams. Okay, I'll help you learn this stuff. But for starters, past level detail is we know the MCA is affected because it's the lateral aspect of the left cerebral hemisphere. So now we move on to motor versus sensory. Well, we know that because the infarct was anterior to the central solstice, that's going to be motor. So the primary motor cortex, anterior to the central solstice, primary or aka pre-central gyrus, and the primary sensory cortex is posterior to the central solstice, aka post-central gyrus. So we're looking at MCA with motor dysfunction so far. And another way to remember that motor is anterior, sensory is posterior, is that this carries through to the spinal cord. If you think about the anterior roots / horns, and the which is motor, and then posterior / dorsal roots horns, that's sensory. So we're looking at MCA and motor dysfunction. Now, are we affecting the leg versus the left arm and face? Now, this is homunculus, which refers to parts of the body at certain locations of the brain. Now, the lateral aspect of the cerebral hemispheres is going to be contralateral arm and face. Whereas if we had the medial aspect of the brain for an ACA infarct, we would have contralateral leg affected. So in this case, the correct answer is we would have MCA, motor dysfunction, contralateral arm and face. So MCA, MCA, motor dysfunction, right arm and face. So many fucking answer choices. I can't even find the correct one to highlight it here. Okay, so it's contralateral always when we have an MCA, ACA infarct in terms of the side of the body that's affected. This can get confusing when we talk about brainstem findings, all right? So if we had a brainstem infarct, such as lateral pontine syndrome, that can cause an ipsilateral Bell's palsy. Okay, so when we talk about the brainstem, the ipsilateral face can be affected. But when we talk about the cerebral cortex, we're going to get contralateral face that's affected when we're dealing with an MCA infarct here. Okay, so your short point of consolidation is that ACA is going to be the medial cerebral hemisphere. MCA is going to be lateral cerebral hemisphere. Motor is going to be anterior to central solstice. Sensory is posterior to the central solstice. And then when we have an MCA infarct, we're going to have contralateral arm and face affected. If we have an ACA infarct, we're going to have contralateral leg affected. And once again, I'll link my neuroanatomy PDF below. Beautiful diagrams on this stuff, and you can look at it more in detail. You know the deal. I'm going to make more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.